must be Christy. You're here, I see, for your 35-week checkup. Before we get started, do you guys have any questions today? I haven't met you before.
I'm their mother-in-law.
Oh, okay.
Yeah, we have lots of questions.
Okay,
She's just crying and she's moody all the time. She's screaming at me one time, and then another time she's crying and
I already told you about that, though.
Mom, please.
I told you this whole appointment was just going to be a waste of time, that I already knew what was wrong, everything that's wrong with her.
I always hear so much from you.
I Googled it.
Yeah,
She has
Google
girl
is
hormones raging through her body because she has a baby girl. Can't you see how she's carrying? It's obvious she has a baby girl.
You don't know what's in there.
And then I took the string with the ring on it.
You have no
She
idea
has
what's in
a
there.
girl.
Well,
You're not
She
a
has
doctor.
girl
You're not a
hormones
doctor.
that are making her all moody.
You know what, guys? That's actually not an uncommon concern, and it's pretty common. It does have to do with her hormones, but it's not really indicative of the sex of the baby. She's going through a lot of hormonal changes with the pregnancy and also a lot of metabolic changes. So it's all going to make her a little bit moodier. Plus the stress of the upcoming delivery, changes in the way your family unit's going to be, so it's all really common.
I mean, it's okay, but it's like really making me crazy.
Well, the best thing that you can do is just offer her as much emotional support as you can and just try to be patient.
Right.
It might help if you do a little bit around the house, too.
Yeah, whatever.
Okay, guys, do you have any other questions?
I've just been feeling really uncomfortable. I get short of breath. I can't breathe sometimes. And I get leg cramps when I lay down. Is that common?
Is there anything, have you tried anything with the leg cramps? Anything that makes it worse, or just when you lay down?
Just when I lay down.
Okay. Well, actually, that's common too. As you're nearing the end of your pregnancy, there's a lot of pressure on the nerves, and so it's going to cause cramping. You can try heat or massage on the legs.
I'm not massaging you.
You better.
I'm not.
Why not?
What you can also try is it's called dorsiflexing the foot. And your partner can do this while you're laying in bed, and it's just
Get Mom to do
pushing
it
the
since
foot
she knows everything.
backwards. You can do it yourself actually on a chair. You just stand against the back of a chair and you put your back foot like this, the muscle that's spasming, and you put pressure on it.
Here, try it, honey. Go ahead and try it.
No.
See, she knows everything. Get her to do it.
And you said you've been short of breath? The shortness of breath actually is really common too. About 60% of women in your phase of the pregnancy experience it, just because there's not a lot of room for your diaphragm to move, and that's what helps you breathe. So you can just try having better posture.
What if
keeping
she
your back up straight.
exercised or something like that?
She could try some light exercise.
Don't put your hands over your head, though. You know what happens.
What happens?
The cord will get wrapped around the baby's
Oh,
neck.
no.
And, oh my God, whatever you do, don't, jumping jacks, out of the question. You'll strangle the kid for
Jumping
sure.
Well, there isn't actually any correlation between exercise and the cord getting wrapped around the baby's neck. It just happens sometimes. The way
4
that the
times.
baby
I've
moves.
heard of it wrapped around 4 times.
She's making me nervous.
She's crazy. I knew we shouldn't have brought her here today.
Oh, you know, she just seems very concerned about you guys.
Because you don't seem to have any concern.
I'm here, aren't I?
Well, barely.
Well, Christy, if the shortness of breath gets any worse, let us know. But otherwise, it's pretty common.
Well, what about this heartburn? I have heartburn. I've never had heartburn before.
Unfortunately, that's common too.
You're going to have a really hairy baby.
I wouldn't warn you.
Full head of hair might have hair all over. Hair on her back.
That's
Hair on her back,
gross.
just like Toni.
I took care of that. It's not there.
That's actually, it doesn't mean you're going to have a hairy baby. Actually, it's from the hormone progesterone, which is one of the pregnancy hormones, and it causes your GI tract to move more, and that can cause some extra acid reflux. So,
What can I do about it?
well, how's your diet? Are there any foods that trigger it, or do you just?
It just happens all the time.
You can try avoiding fatty foods or spicy foods. You can try sipping some tea, things like that. If it gets really bothersome, you can come back and talk to us, and we might try some over-the-counter medications. But for now, I would just try avoiding those types of foods.
Okay. And she's always, always, always hot. No matter what. Laying in bed, we can't go to sleep because she's turning down the air conditioner. I'm freezing, so I'm running over and I'm turning the air conditioner back up. I really don't know what to do. She's just killing me. We have like 3 fans on the bed where I'm just sitting there freezing in bed.
Well, it's just a really uncomfortable time of the pregnancy. You're gonna have, the backaches, and you're gonna be hot. Just, your metabolic rate is up. It's just the best you can do is with the fans and just trying to stay cool. Wearing cotton. I don't know what you wear to bed, but if you wear cotton,
I made her wear nothing to bed.
oh, well, you can't get much better than that. Cotton sheets? You don't use silk sheets, do you?
I told her she couldn't use any covers.
Well, it's almost done. You're almost to the end. Have any other questions?
No, not so far.
Okay. Have you been noticing any problems with any bleeding in your gums or any pain?
No.
No? Okay, that's
You're
good.
gonna lose a tooth though,
And
every
she
time
won't
you have a
tell you.
baby, you're gonna lose a tooth.
She won't tell you, but she's been having a problem with hemorrhoids.
No.
Oh, okay.
She has.
Well, the best thing you can do is preventative-wise is to try to eat a lot of fiber-rich foods and keep up on your fluids to avoid constipation.
Preparation H, and it works great for a youthful beauty treatment too.
Well, I don't know.
Ask her, she should know. She uses it often.
Dark
Dark
about
circles,
that.
wrinkles, gone.
See, she was good for something.
Yeah.
But other than that, you can try some warm sitz baths for your hemorrhoids or some over-the-counter Preparation H would be great.
Well, you can grate radishes and mix them with honey and a little milk and apply it directly to the affected area.
Yeah, okay, we're
That
gonna put
helps
radishes
too.
down there.
I would avoid putting any food items down there. We don't want to have any infections, so.
It's supposed to be very soothing.
Anyways,
She's crazy.
I can give you a referral to a friend
we
of
don't, I don't
mine.
need her.
Anything else?
No, that's it.
Okay, well.
Next time we won't bring her.
All right, well, I'll go ahead and get you in the next room so the doctor can begin your exam, so you guys are all set.
All right.
Thank you, doctor. This was a waste of time, I know.
Come on, baby, why don't you give me some gloves? You have one thing to do? Come on, you have anything